When NJBiz released its list of 2022 healthcare heroes, Dr. Gian Varbaro, the chief medical officer of Bergen Newbridge Medical Center in Paramus, was surprised, honored, and humbled to learn he had been named one of the Physicians of the Year.
First, I was greatly honored to be given the award, but what I really thought was this is an award not just for me, but for our whole team. It's really a recognition of all the work we've done here over the last 4.5 or 5 years, including our response to the pandemic and in addressing all of our communities here in Bergen County. So it's a great honor, but like I said, it's a reflection of my team here as well.
So, what does it take to be named a Physician of the Year? Varbaro says the same qualities that make a good doctor and leader.
One is empathy, actually, is just understanding what people are going through. People have been through so much these last few years that really understanding where people are coming from, both your patients and your whole team, and where they come from and what's going on with them, so that you can really work with them and work with people where they are and come to them where they are, I think is really important. And then the other part is just not being locked in on having to do things in one way and just being able to be creative and pivot and do whatever you need to in order to get the actual job done.
That empathy and ability to change strategy at a moment's notice has helped Varbaro and his team navigate the past 2.5 years. Medical professionals confirmed the first coronavirus case in Bergen County in early March of 2020. From there, the virus began its rapid spread across the area, country, and world.
It was crazy, especially right at the beginning when we got hit, especially at the beginning in Bergen County. There was so much. I think people don't realize how much we were hit in Bergen County. We were hit pretty much like New York City was at the same time. So it really was just, it was just a lot of sleepless nights. It was a lot of just working 24/7. Even when we weren't here, we were on the phones and adjusting and getting through and just trying to make things work. And every minute at the beginning, things were changing. And then even after that initial push, it was just, again, being willing to come to people where they were and just adjust, because everything, it seemed at certain points like daily, the entire setup would change. So it was crazy, but in some ways it's kind of what we train for.
Nearly 30 months later, COVID-19 remains a concern. In recent weeks, the Omicron subvariant BA.5 has been contributing to another surge in cases. Officials say the highly contagious variant caused an estimated 65% of infections in the U.S. last week. While this latest surge continues, Dr. Varbaro says we are in a much better place than we were just several months ago and is optimistic about the fight against the virus that lies ahead.
We're in this state right now where we're going to be for a little bit as COVID transitions. It's not the full horrible pandemic it was before. It's not completely endemic yet. We're kind of in this in-between space. It's just why you keep seeing these little mini waves of new variants. There's a new variant, the B5 variant out, that's very contagious. And you're going to see that happening over time. Eventually, it's going to get to a point where it becomes just a regular illness. That's what always happens with pandemics. They always change into something that's kind of there. The 1918 flu is part of the yearly flu now. So eventually COVID will become like that. We're still kind of working our way towards that, so we're not quite there yet. How long it's going to take, I'm not sure. We're actually getting there much faster than in previous pandemics. If you look at the history, I think that has a lot to do with the vaccination efforts and with all of the medications. That's the other thing. It's been really amazing how quickly this has all happened. I know it doesn't feel that way to people, but if you really think about it, COVID-19 originated in 2019. That's why it's called 19. And we already have multiple vaccines, multiple therapeutic medications, multiple treatments, which is pretty remarkable.
Working through the pandemic has not diminished Varbaro's love of medicine and helping people, although it would have been understood had it done so. But Varbaro says he loves his profession and says that is key for anyone looking to pursue a career in healthcare.
Come in with an open mind. You'll end up in places you don't expect to be. I never in a million years thought I would end up in leadership when I started. It was not my intention, but it ended up being my passion, and it's what I love doing. And it's the most rewarding career you can have if you love it, but that's why you should do something that you love as part of it.
Varbaro says healthcare and medicine is in a very interesting space right now, and lessons learned from the pandemic can help spur innovation and new treatments for not only COVID, but also other viruses, diseases, and ailments.
Healthcare has been changing for my entire career. It's really changing now coming out of the pandemic, and I think that there's a real opportunity to create new things. What really excites me is the opportunity to think of new ways of treating things that we used to, or better ways. So we're doing a lot of things that I think are going to be really exciting. There's going to be some programs here at Bergen Newbridge in the next year or so that I think actually could be leading in the country. And I'm really excited to build those things and to figure them out and to move on the fly and adjust them as we're going to need to, because it never works out initially the way you originally planned.
Creating new things has been a major part of Varbaro's medical journey. Having grown up in New York and attending medical school in the state, Varbaro completed his residency at Robert Wood Johnson. That's where he started his career and started a hospitalist program there. He then spent a decade in Connecticut, working at Yale New Haven Hospital, and helped to found the Quinnipiac Medical School. From there, Varbaro ventured south and helped turn around a hospital in Miami before returning home to the tri-state area.
At some point, I became the build a new thing or turn around a place guy. Like I said, that's really what I love doing. So I guess I found what I was looking for. I found what I love doing.